Good afternoon. Thanks for joining us for this special physician education webinar series by Dr. Joe Baumgartner. Just a little bit about Apex Biologics, if this is your first introduction. Apex Biologics is a complete resource for regenerative medicine, providing physicians specialized training, comprehensive business services, and premier supplies to improve their practices and enhance the lives of the patients they treat. Today on today's webinar, we've got Dr. Joe Baumgartner from Regenerative Medical. Dr. Baumgartner is a board-certified physician with a specialized fellowship in non-surgical orthopedics and sports medicine. He utilizes the latest in diagnostic and treatment technology to better treat musculoskeletal injury and pain. Dr. Baumgartner has authored the book Regenerative Injections: The Art of Healing, focusing on regenerative injection techniques. This book is used as the manual for the AAOM and Hemwall Hackett Patterson Foundation. The Level 2 book is scheduled to release next month, focusing on detailed ultrasound evaluation and injection techniques of the spine and peripheral joints. He's also a contributing author on the subject of pain management for a variety of other popular publications. His recent book, Regenerate, focuses on all of the lifestyle factors that contribute to body regeneration and degeneration. As an international speaker, he instructs both physicians and those in the medical industry on pain evaluation, diagnosis, and the latest treatment options. So without further ado, I'll turn the time over to Dr. Baumgartner.
Thank you. Well, it's great to be here, and it's pretty exciting to talk about things that I am super passionate about, which is, regenerative orthopedics, PRP stem cells, and training other doctors to better themselves and better their practice and to be able to make this work in a kind of independent practice. So part of what I'm going to talk about today is how to optimize your regenerative outcomes with some kind of body, biohacking things we can do. I'll kind of present what I call the CFAN model, but I'm going to kind of blend that with almost like a business talk on how do you guys basically take your practice and blend, some of the stuff into your business. And in the future too, I can come back and we can do really focused talks on, marketing and those types of things as well. So today's kind of going to be an overview, hopefully just a string of pearls of things you can do to add to your practice to increase outcomes, but also to increase your bottom line as well. So, a little bit about myself, a little bit of the overview of the talk, like I said, is we're going to try to go over what I call the CFAN model and how you can incorporate that into your practice to increase your outcomes, but also how to use that CFAN model as a kind of a revenue stream to augment your current practice and also the revenue streams with your regenerative practice. So, my story, I kind of consider myself kind of a Superman, but a super nerd at the same time. And I'm always trying to better myself and always trying to become the best version of myself. But, we all have kind of a story. We all kind of have a past. And my past, goes way back when. And I was, a young little kid. And as a kid, I was really good at a few things, and I was really good at gymnastics, and I was really good at art. So kind of two really different things. Eventually, my family moved up to North Dakota, and we kind of settled in a little town called Dickinson. And Dickinson was kind of where, football, rodeo was kind of king, and gymnastics and art were kind of awkward for a young boy to do. But it was kind of cool. It kind of taught me to be outside the box and to be okay with who I was and, be creative and really thrive on being a unique individual that I found out that I actually was. And it kind of took me through high school where I, thrived and, had a lot of friends and did good things, but was still kind of searching for what I wanted to do with my life. And I was going to go to school and be an artist. And so I went to art school for actually 4 years. And as I was doing that, I decided, art school is good, but you live in a box. You don't get to really interact with people. So I kind of said, at the same time, I want to help and really change people's lives. So I said, I'm going to apply to med school just to challenge myself, and ended up getting accepted in med school. All was good, and ended up wanting to do something like primary care where I can really help a lot of people. So did a primary care residency. But at the end of that, I felt kind of like, gosh, this is not what I wanted to do. I was prescribing a ton of medications and wasn't seeing anybody lose weight, wasn't seeing anybody's, get really healthier. I was just seeing larger medication lists. So I went back and I did a fellowship in non-surgical orthopedics and sports medicine, which really changed my life, I think, for the good and forever, because it started to show me that I can actually do some stuff to really change people's lives. So it took me kind of to my first job. Again, was kind of just, doing sports medicine, but more in a environment that was, pushing more cortisone shots, pain medication, anti-inflammatory drugs, and things that weren't making a difference. And so about 15 years ago, started looking outside the box and getting more training in functional medicine. Eventually became passionate about regenerative orthopedics, regenerative medicine, which has now led me 15 years later to just be in my wheelhouse in treating my patients the way they deserve to be treated, which is optimizing their health, getting them to lose weight, getting them to be healthier, and which has kind of brought me to where I am today, which is kind of a hybrid model of regenerative orthopedics blended with functional medicine, and then also lifestyle medicine and fitness and all those other things that really make a big difference. So, 10 years ago, I had a small little gym. It was just basically my physical therapy department and a treadmill. And then eventually we kind of added on kind of a warehouse where we took our fitness and we started training people indoors. It got cold here in Minnesota in the wintertime. And then eventually we kind of expanded that to kind of a hybrid of everything that I was passionate about. Fitness meets functional medicine meets regenerative orthopedics. So we kind of opened up this Taj Mahal of regenerative orthopedics, which is like a 26,000 square foot integrated building with all kinds of exciting things that are happening. And so what we've been able to do over the last, I would say, 10 years is really refine how to present yourself in your community, how to present yourself to maximize the types of patients you want to have come into your practice. Because it's great to do PRP, it's great to do stem cells, it's great to have these great outcomes. But if people don't know about you and know what you're doing, it's hard to get those patients in the door. So we really figured that out, which has been exciting. One thing that was really humbling for us is, we've always been outside the box, just like all of you guys as well. You've been trying to do what's right in your community. And for a while, the orthopedic community would say, oh, he's injecting snake oil over there, which they were referring to my PRP that I was doing. Now they're all doing PRP and stem cells. All my competition, which is, your orthopedic clinics, are trying to compete and do the similar thing. So you've got to diversify yourself and not just be a stem cell clinic or PRP patient, but be an overhaul lifestyle type medicine place that's not just looking at the joints, but looking at getting them healthier, getting them losing weight, and really creating a healthier person. So one thing that we do anytime we hire people here at Rejuve is we look at 3 core values, and that's virtuous, brilliance, and results. So everything we do, we want to do from a very humble position where we're trying to get people better outcomes, do what's right for the patient, do no harm. We want to be smart. We want to be brilliant. We want to be always creating a better version of ourselves, always getting mentorship and better education. And the bottom line is we want to get results. We have to get results. That's why we have such a high reputation. That's why we have such a high volume of regenerative patients. It's because we get good results and those patients become our walking billboards. I think to be a good regenerative medicine practitioner or physician, you have to know why the body's breaking down. So I want to kind of dive into a little bit of what's happening, why our bodies are breaking down, so that we can be best informed on how to get these bodies healing and regenerating. If we look at why the body breaks down, there's really a few different reasons why. We can look at lifestyle. 40% of our population is overweight. They've got poor nutrition habits. They're smoking. They're not exercising. No matter what you do, you're going to break down your body. We live in an environment of stress where it's go, go, go. We're not sleeping well. We have emotional stresses. Our hormones are imbalanced. Our genetics might be off. Or there could be some trauma. You could have a car accident or fall down a flight of stairs or fall off a horse. That trauma is going to break down your tissue. If you look at the old model of orthopedics, it was like, let's do pain medications, let's do narcotics, let's do cortisone shots, or let's do surgery. We know now that there is a new model with healthcare, and that's kind of what I'm passionate about as well, as combining the best thing we can do from an evidence-based perspective to get the bodies to heal and regenerate. And so that's what I've combined here, is my clinic focuses on regenerative orthopedics, combined with medical fitness, which is lifestyle medicine, getting people healthy, combined with functional medicine, which is looking at the core root of why people are breaking down. Why are they overweight? Why are they fatigued? Why are their hormones off? Why is their adrenal function messed up? You've got to put this triad together to get those great outcomes, and that's what we're finding we're getting here. Our goal is to really redefine healthcare and to create a model of healthcare that does heal and doesn't cover up the problem. If you look at evidence-based treatments, if you look at what it has a lack of good evidence when it comes to, for example, the knee, NSAIDs, cortisone shots, have actually been shown to cause more degeneration in the knee. People that take chronic NSAIDs have more chronic total joint replacements. We have shown now over the last 5 years that meniscal surgery is no better than placebo, but 100% of the time is going to increase your risk of arthritis to the joints. So we don't necessarily want to go that way. As far as things over the last probably 10 plus years that have shown good evidence for healing and health to the knee, nutrition, losing weight has a positive effect on the cartilage, the pain, and your ability to do things with your knees. Physical therapy, fitness, there's supplementations that have been studied to show they're very helpful for arthritis. looking at people's hormones, genetics, and actually prolotherapy, PRP, and stem cells are starting to get really good level 1 evidence showing it can help with degenerative arthritis and help with cartilage and decrease pain in those joints and better function as well, which is pretty exciting. Why is this happening? If you look at the United States, there's a trend which we have to address, because if we don't address the trends in health, we aren't going to get their joints better and get our patients feeling better. So unfortunately, by 2020, which is in about 6 months, it's predicted that about 40 to 45% of our adult population is going to be in the obese category. What's even more sad is about that same percentage of our children are in that same category. So children are having strokes less than 20 years of age. They're getting degenerative disease. They're getting type 2 diabetes. We've got to make trends and changes in our healthcare. And I say this because I'm looking at joints, but when you have unhealthy protoplasm, you have unhealthy joints. When you try to regenerate someone's knee or spine or hip, if they've got bad protoplasm because of lifestyle problems or inflammatory obesity problems, it's going to be hard to get their joints better. Let's just look at arthritis. If you look at the risk factors for arthritis, women after menopause, increased risk of arthritis because their hormones get off, more osteoporosis, more cartilage breakdown. Nutritional factors, obesity, of course, plays a role. You can have bad genes, genetics, you can inherit certain things. We're also finding that cortisone shots increase risk of arthritis, which we'll touch on here coming up in a second. All this stuff is really creating a healthcare implosion. So we have our elections coming up in 2020. It's going to get political. You're going to have both sides of the aisles fighting over what's the best way to have healthcare. The truth is the best way to reform health care is to make healthy people. And I'm going to present here in a second what I call a CFAN model, which is something we can all use to implement health in our patients. The healthier our patient population, the better our outcomes are going to be with orthopedics and our regenerative things. So we look at kind of medications prescribed. About $325 billion are spent per year on medications, prescription drugs. Of the ones I have listed here, 7 of those are for lifestyle preventable illnesses that are related to lifestyle, like hypertension, diabetes, chronic pain. So a lot of those things we can treat in other ways, and we aren't going to have to increase the cost of our healthcare with all these medications. What about NSAIDs, right? The old days, and even in my sports medicine training, somebody comes in with a bad shoulder, number one thing was give them some anti-inflammatories. It's an inflammatory problem. We know that NSAIDs increase risk of arthritis. People taking chronic NSAIDs have a 2 times increased risk of a total joint replacement, and with acute soft tissue injuries, delays their healing. So we really want to get people off their NSAIDs because there's no good evidence to actually do any help. We all know cortisone, especially the doses given in orthopedics, are detrimental and chondrotoxic. They actually break down cartilage. So the last thing I want to do or promote is getting a cortisone shot in that joint or the spine. This just shows a 6,000 patient study. 3,000 people had cortisone shots, 3,000 didn't. Those that had the cortisone epidurals, spinal epidurals, had a 29 or 1/3 increased risk of a spinal fracture for every single epidural given. So we're, in my practice personally, we're avoiding all cortisone shots. We do a lot of epidurals, but we're doing more of a dextrose-based epidural based on some recent research saying it's safe in the epidural space, but as effective or more effective than those steroids, which can be damaging. We know steroids, when you do it in the tendons, what does it cause? It causes pop. It causes a tendon rupture. So we want to avoid that as well. Another study looking at cortisone in the epicondyle of the elbow, not good, does not help at all. Why do we even look? Why are we all excited about regenerative orthopedics? Because surgery is not always the answer. Now, every day I'm sending my patients for surgery if it's a good indication. The truth is 96% of orthopedic problems are non-surgical, and we can handle during regenerative treatments or physical therapy or other things that can be helpful. So it's not always going to have to be a surgical problem. The problem with surgery is it's 1, super expensive, and 2, some of those surgeries don't have high outcomes or success rates. For example, spinal surgery. We have about a 50% failure rate, but $80,000 for the spinal fusion. Knee meniscal surgery, we've already talked about, no better than placebo, but increases your risk of arthritis. And meniscal surgery is that it's in the billions as far as what's costing your healthcare system, again, without an effective decrease in pain over the long run. Joint replacements, know how expensive they are as well. A lot of joint replacements, too, are done, and it's not really focusing on the root of their cause. The pain in the knee might have been coming from the hip, the back, or actually irritated saphenous or genicular nerves around the knee. So there's a lot of other things in the knee that could be causing the pain. So we got to get the right diagnosis as well. One question my patients always ask me, can we really regenerate? I'm going to kind of go into detail now a little bit about why I wrote my book. My book's called Regenerate. This is more of a consumer-based book teaching our general population about the options that they have, as well as how to do lifestyle changes to optimize their outcomes. So the question is, can we regenerate? Yes, we can. We can have an influence on the body. Our body is constantly trying to regenerate, right? When you sprain your ankle, it goes in, it heals it, it sends platelets and stem cells and heals up that ankle. If you fall off a horse, you're bruised and you're achy for a while, but the body tries to repair itself. Now, it doesn't always heal 100%. That's why we're getting chronic degeneration and arthritis, because the body never really heals 100%. But we can definitely tip the pendulum into the healing mode, which can actually help long term. And we'll talk about some things we can do here to tip that pendulum to help us get better outcomes with our procedures. I like to call it the CFAN model. I use the CFAN model as kind of a basis for all I do. Every patient I come in, I touch base on the C, the F, the A, and the N, which I'm going to go into a little more detail here. Why that's super important, it creates health in my patients, but it also increases my outcomes in my regenerative procedures. That's why we have some of the best outcomes in the nation right now with some of the things that we're doing. So you really want to make your practice thrive. To make your practice thrive, you've got to be innovative. You've got to constantly be learning. You've got to be outside the box. And you've got to do things that make your patients better. That involves integrating a lot of different things. It's not just squirting some stem cells in the joint, but it's integrating all the other things, which we'll talk about here in a second, to optimize the outcomes. When you do that, when you're innovative, when you integrate things, you really get those optimal outcomes. Why do you want to do this? Stem cells are becoming very common. 5 years ago, 10 years ago when I first started, it was pretty easy to market yourself. Nobody else was doing it. There was no competition in your market. Now you've got to be very savvy. You've got to be very good, and you have to be very cutting edge. But you also have to be aware that you don't want to be doing things that you shouldn't be doing that aren't evidence-based, because the FDA is going to be watching all of us to make sure we're getting good outcomes. We aren't having infections, that we're at a standard of care. We're doing everything that we can in an evidence-based way to increase our outcomes. So we want to make sure everything we're doing has good research behind it, is safe, efficacious, and we got to compete against all the other ones that are out there that maybe aren't looking at all those factors as well. So let's talk about the CFAN model. So I'm going to jump right to the A, and I'm going to come back to the others. But the A is the articulation. It is why patients are coming to see you. They have bad backs. They have bad knees. They want you to help them because they've heard from their friend that you're really good. And the A is the articulation. It's the joint. It's the PRP, the stem cells, the unloading braces, the physical therapy, the manipulation, things you're doing to make their spine or joints healthier. The goal with their articulation is to reduce those destructive environment, increase the health of their cartilage and the volume of their cartilage, improve range of motion, and really all they want is to be able to run and play and water ski and play with their grandkids, and that's you need to be able to return their quality of life. That's going to be golden if you can do that. Again, the articulation is the joint, it's the meniscus, it's with the ligaments, the things that are supporting that joint. Why do joints break down? They break down because of instability. Yes, there are a lot of other factors that influence that, like we talked about before, hormonal factors. Are you taking NSAIDs? Do you have cortisone shots? But in general, joints break down because there's a remote injury from the past that never healed, and over time it's breaking down. That's why when I teach doctors how to do PRP and stem cell procedures, I talk about every little ligament, every little piece of cartilage, every part of fascia that supports the joint, in the goal of getting that joint to become more stable and less dysfunctional. So the knees, of course, very common. MCL sprain down the road, 10 years later, they got a bad knee. Spinal injury, so we're talking about more of a strain sprain, like a car accident when they become forced into kyphosis. They sprain their interspinal ligaments, their transverse ligaments of their spine. They can rupture and tear some of the multifidi muscles. Over time, they develop pain and arthritis because eventually the discs start to bulge. They start getting pressure down their legs. They start getting radicular pain. Eventually, they're going to get that facet pain, which causes back pain all over again. Our goal when treating injuries, whether it's the spine, the knee, is to return stability back there. And that involves regenerative treatments to the ligaments, the joints, the fascia, the muscle attachments, all those things when combined. And sometimes throwing in an epidural using dextrose, not cortisone, is a very effective way to get those backs healing and to help with their pain. So how do we do this? We use biologics, and that's what you guys are doing and excited and passionate about. So biologics really include three things: prolotherapy, PRP, stem cells, and there's a lot of more biologics coming down the pipe from amniotic to other things. But these are the ones that really have, I think, the best evidence and the best kind of research to prove efficacy and help. What is prolotherapy? Prolotherapy is basic. It's been done for 60 years, most commonly done with dextrose. And the definition of prolotherapy, it's the rehabilitation of an incompetent structure through the proliferation of a new structure, like a ligament or a tendon. PRP, kind of not necessarily the new kid on the block anymore, been around for 15 plus years. But what we're doing with PRP is we're taking these platelets from the blood, just like in injecting them back, and they release different growth factors. Those growth factors have a positive effect on the healing, which can help with cartilage health. It can help to tighten up ligaments. It also can help with meniscus and other soft tissue problems. Newest kid on the block are the stem cells, which can come from adipose. They can come from bone marrow. Personally, I like bone marrow the best, mostly based on research showing that bone marrow-derived stem cells tend to be best for orthopedic conditions. But how do stem cells work? They do a few little things. I'll just summarize it really quickly. First thing they do is they come in, they see something's kind of injured, stem cells bind to it, say this is a cartilage cell, and they transfer their mitochondria. Mitochondria is what? It's the powerhouse of the cell. So it's kind of like giving a battery transplant to that unhealthy cell. Next thing they do is they kind of come in, they realize, wow, this is a very unhealthy inflammatory environment. The macrophages in arthritis are very overactive. They're starting to munch away tissue, trying to do what they're supposed to do, which is remodel. But they end up actually starting to eat up some of the healthy cartilage as well. So stem cells tell them to actually chill out, and they stop the destructive environment of that overactive macrophage. The next thing they do is a stem cell goes in, it binds to the environment, and says, wow, this is really bad. This is some pretty advanced arthritis. And it uses paracrine signaling, which is like kind of like a firework. It says, hey, there's a damage here, and it recruits more stem cells, platelets, and growth factors to come to the area to aid in the repair of that damaged cell. And then finally, the last thing that it does is it acts as, let me just advance this here. There we go. It acts as a, kind of helps with new protein synthesis, and it does that through ribosomes. It transfers over the ribosome from the stem cell into the unhealthy cell. Ribosomes carry RNA. RNA is the new template to build more healthy protein. So kind of does a little ribosome transplant there, which is pretty cool. This is just an example of stem cells kind of going in. My goal here was to recoat that medial condyle, putting the stem cells into that. Now, as far as evidence goes for these things, there's actually a lot of level 1 evidence for simple things like prolotherapy, which is a concentrated dextrose solution in the joint. There's a lot of evidence on PRP showing it's helpful for tendon injuries, meniscus, ligaments, and most exciting thing I think is it's helpful for osteoarthritis or loss of cartilage. There's a lot of stem cell evidence, especially in the knees, rotator cuff, hip, lumbar, and actually the ACL now. There's some evidence showing that we can actually help with ACL partial tears and sometimes full. This is kind of when you're kind of marketing yourself out there. You want to market yourself as just not another place that does PRP, but market your clinic as being very innovative. Market your clinic on using an integrated approach, and market your clinic that you get results and you optimize those things. And I'll show you some things you can do here. As far as being innovative, all of us that are doing regenerative procedures have to be good at what we do. You know, it's no longer like 10 years ago, it's a palpation based and you kind of squirt it in the joint. We have to have precise image guidance. So you have to be very skilled at ultrasound or fluoroscopy skills to make sure that when you're putting the tissue or the transplants in there, whether it's PRP or stem cells, it's getting in the right spot. So precision guidance is super important. We like to use ultrasound for most of our injections. We use fluoro for certain things in the spine or the ACL. You want to make sure that you're maximizing what you can do with the product you have. So there's a lot of different things you can do with PRP and stem cells. You can also save your platelet poor plasma, add dextrose to it, and I call that platelet poor plasma prolotherapy. When I'm doing a low back or spine, I'm using 100 cc's of solution. And the stuff I'm getting with PRP, if I'm getting 4 to 10 cc's of PRP, I've got to use the platelet poor plasma to extend that, which is fine because platelet poor plasma has got some good studies in use into muscles and muscle tear. So I use that in the lumbar spine, for example, to inject some of those deficits or fat infiltration we see in the multifida muscles. Lots of different things you can do there. As far as innovation goes, you have to be really good at your injection. And my first book was, focusing on the palpation-guided injections and getting that done, which was a great book. It taught a lot of people the basic of how to do prolotherapy and regenerative procedures. My second book, which is coming out next month, is also called Regenerative Injections. It's basically level 2, which is focusing more on the ultrasound guidance of all the little structures, the ligaments, the fascia, the meniscus of the spine, the joints. Super excited about it. I think it's going to be very helpful for a lot of people to make sure that we're all using a higher quality of stem cells. This is kind of a fun slide just because, remember, I was an art major, so I was able, with this book, you can see the knee slides there, use my, I always wanted to be a medical illustrator, so I actually did all the medical illustrations for this book as well, which was fun because then you could take the concept in your head draw it out and make it very easy and take those concepts that were complex and base them down to something that was simple that can be taught and learned. So look forward to that coming out in about a month. It's going to be pretty exciting. When I do a lot of training too, we talk about how to optimize outcomes. And so that's why I want to go into the CFAN model. So it's not just squirting the joint, but what else can we do to optimize those outcomes? So the next thing I want to talk about is probably one of the most important things, not just for regenerative outcomes, but for overall health and overhauling healthcare as well, is that cell health. And what is cell health? That is, what's happening in their mindset, what's happening with their fitness, what's happening with their nutrition, what's happening with their body composition. Are they decreasing fat, increasing muscle? Have you optimized their hormone or had a functional medicine workup? Are you controlling inflammation and those inflammatory factors? Are they staying hydrated, drinking enough water? And super important, are they getting 8 hours of sleep at night? Sleep is when our body regenerates. And so we actually do have to counsel our patients on sleep and all these lifestyle things too, because then we'll get much better outcomes. So the goal for you guys is all these things can be smart business as well. When I say that, when you start implementing health coaching, weight loss programs, nutrition counseling, selling nutritional products, functional medicine evaluations, all that is great for the patients, but it also diversifies your practice, gives you different revenue streams. So your practice is no longer based on you cracking the whip and seeing more patients. You kind of develop this integrated practice that works for you. So I don't have to feel guilty about going to Hawaii for 2 weeks come spring, because my practice is still thriving and working based on all these cell health things that we're implementing as well. So first thing is fitness, right? It's the basis of all health and fitness. Medical fitness includes nutrition and exercise and getting people to lose weight and doing all those things as well. You just kind of saw what our gym looked like. So a large part of my actual size of my building is a fitness center. And this is an example of a Biggest Loser competition we had a couple years ago. And I love this story because I love the slide. And you can see Jen here with her daughter, and she's obviously, overweight. But she has a responsibility to teach healthy lifestyle to her daughter. In the second slide there, you can see she won the competition. She lost, almost 70 pounds, over a quarter of her body weight. But she wasn't done. So a year later, she actually lost over 100 pounds, over half her body weight. She was off all of her prescription medications. But Jennifer became a walking billboard for Rejuve, but she also became a good role model for her daughter, which what tugs at my heartstrings, because that's who I care about, the kids and the next generation. Is we have an obligation to that, and Jen did amazing, and her outcomes with her regenerative treatments are going to be that much better as well. Health benefits of medical fitness, everything possible from diabetes to cancer to low back pain to arthritis, all the benefits of fitness, exercise, weight loss, nutrition, studies show are very helpful for patients. So we should be counseling patients on these things. Study on exercise, weight loss, and osteoarthritis. It's very helpful for osteoarthritis of the joints. Now, what about nutrition and everything we do? We want to induce autophagy. So autophagy is this new thing saying we need to get the body to recycle its old cells. How can we induce autophagy? And this is a whole different topic. Different things we can do. And personally, like right now, what time is it? Almost 3, 4 o'clock, and haven't eaten today. So I'm fasting. I've got good mental sharpness. I've got tons of energy, but my body is in autophagy. So I'm recycling old cells. There's a lot of studies on fasting, which I'll touch base on here pretty soon, as well as stem cell numbers and stem cell health. So if you are in the stem cell environment, start looking at getting your patients to do some intermittent fasting prior to procedures. It increases your cell numbers and quality of your cells. Exercise, of course, drinking coffee. I'm drinking some iced coffee right now. Here's a little sip. Liquid autophagy. Different supplements like turmeric and olive oil increase autophagy. Olive oil is amazing. It's a great anti-inflammatory. It's a good fat. Can't get enough of it. Mediterranean lifestyle. Next is nutrition. We do a ton of nutrition counseling. We've got online nutrition programs that we send home with our patients. We talk a lot about nutrition because if they aren't eating healthy, if they're eating pizza, inflammatory foods, I can do all this brilliant stem cell PRP, have good technique, ultrasound guidance, but their protoplasm's lousy because they don't eat good. So everybody coming in our door gets a card. We call it the Rejuve University, and the goal of that is to get them eating healthy, moving, drinking water, sleeping well. It's an online platform that we use to educate them because their outcomes are better. Kind of looking at some highlights of what that is all about. I'm going to kind of go to here. So nutrition needs to be a way of life. We need to educate them to make healthy lifestyle changes and make habits out of these. We talk a lot about decreasing carbs. Now, not everybody has to be in ketosis or do a ketotic diet, but everybody to lose weight needs to slide their carbs down. And what we found is if they decrease their carbs to maybe 100 to 150 grams of carbs a day, they're going to lose an average of about a pound per week. And that's kind of what I would call an average healthy, clean eating lifestyle. Now, if they want to lose 1 to 2 pounds a week, they have to get their total carbohydrates less than 100 grams. If they want what we call advanced nutrition, which is nutritional ketosis, they have to have their carbs down to about 30 to 50 grams, which actually I kind of like when I'm prepping my stem cell patients for a procedure. Being on booked out, hey, they're coming in, we're not going to do your stem cells for 2 months. Let's get you in a ketosis lifestyle, get you fasting. They're going to lose the weight, which is going to increase their outcomes because they're going to be less inflammatory. They're going to have less body weight going through their joints, but it increases their stem cell volumes and stem cell outcomes and healing potential as well. We talked everybody about intermittent fasting. We've noticed, and we do a lot of cell counts in our stem cells, is those that are intermittent fasting, they will have better cell count numbers and better viability as well. So this is what we throw out there with a lot of our patients is, there's not one way to eat. You can go vegan, you can go vegetarian, you can be plant-based. We have an autoimmune protocol. You can go paleo, you can go ketotic, you can do intermittent fasting, or you can just do a clean lifestyle. They're all good. It all comes down to decreasing inflammatory foods, decreasing carbohydrates, and then practicing all the rest of those lifestyle things like healthy nutrition, stress management, hydration, everything else to increase those outcomes. A little bit on fasting and increasing stem cell numbers. Next thing on cell health is hormone optimization. So usually we will do kind of a regenerative panel on a lot of our patients looking at basic things like cortisol levels, testosterone, DHEA, estrogen, progesterone, sometimes some higher end functional medicine workups to optimize their outcomes. So there's some basic functional medicine things we can all learn to increase our outcomes. We look a lot at thyroid as it affects every cell in the body. We look at the adrenal glands because if they're not functioning well, the body's going to be more inflamed with low cortisol, but also chronic low cortisol causes a lot of fatigue, decreased energy, and apathy. This is kind of a cortisol profile on a lot of our pain patients is they're flatlined. Their body's not making any cortisol from the chronic stress, which leads them actually really achy, very anxious. They don't have cortisol is what? It's natural anti-inflammatory in the body. So these guys are really achy in pain, that kind of fibromyalgia style patient. We look at sex hormones. We know that sex hormones can be anabolic and help the body heal and repair. And we want to do kind of some basic regenerative panels to make sure we're looking at all these different things to optimize those outcomes with our procedures. One thing we know about nutrition is that it affects genetics. So we're getting a lot into genetic testing as well and making sure that the patient is on the right diet for them. Is keto good for them or is high fat not good for them? It actually could cause more inflammatory issues being on a high saturated fat diet and more cardiac issues. So genetic testing is going to be the wave of the future, again, which we'd like to do a lot of teaching and training on that as well, because I think it's the next level in healing the body is knowing people's genetics to know how they're going to respond to stem cells, how they're going to respond to certain nutrition counseling, how they respond to sleep hygiene and everything as well. So it's pretty exciting. Every one of our patients, again, we told you we have an online platform. They all get these core elements of health, which is their mindset, making sure they're thinking right. They have the right mindset to make habit changes, making sure they know how to breathe. When we breathe, it brings in oxygen that delivers good health and nutrition to the tissue. Making sure they're eating right, which I spent some time on. Are they drinking enough fluids? Do they sleep 8 hours? And are they doing healthy, functional movement? So we have a lot of good relations with our physical therapists, with our chiropractors to work on functional movement, body alignment, and it's just a very critical part of their overall success rates. You can just go outside the box and look at other things that have good evidence with them. Cold lasers, impulse, which is a kind of giving more energy back into the cell using a cellular energy. A biophotonic scanner is a scanner that looks at the antioxidant levels in their body to make sure they're getting enough vitamin C, fruits, and antioxidants. Infrared heat has been shown to increase healing. So actually, we have a lot of infrared heat. We have infrared studio in our gym. We have infrared saunas in the gym because infrared heat increases healing. You can look at other things like hyperbaric oxygen chambers, dry needling, foam rolling, other things, and even peptides. Peptides is the next thing. In fact, I'm going to have a conference here coming up in September, and I'm going to be flying in one of the world-renowned experts on peptides as well as genetic testing to teach all of us the next level on peptides. And how do you give peptides to optimize growth hormone? What peptide cocktails do we give to optimize regenerative outcomes? So I'm super excited about that because it's going to give me and a lot of us the next level ability when it comes to regenerative training as well. Prolotherapy and low-level light therapy. There's good evidence showing that laser therapy mimics prolotherapy in its ability to help with increasing growth factors, increasing fibroblast proliferation, increasing hyaline-like cartilage synthesis, decreasing inflammatory markers, cold laser, very simple. Our physical therapy department has a cold laser. We use that to increase our outcomes after PRP procedures. It's all kind of biohacking stuff. This is kind of cool. So if somebody's coming in to see you for PRP, did you know that you can have them do some HIIT training? Here's 3 different studies showing that high intensity training prior to a blood draw increases the spleen's dumping of platelets. The reason it does that, when you do HIIT training, the body is like, oh my gosh, I'm going to die. So it releases platelets going and trying to help and heal you. Let me have you. Hey, Garrett, can you go get my plug-in for my computer? It's in my room. Nope. Let me see. For some reason, it's not active. We'll get the power here. So you can do HIIT training about 30 minutes before your blood draw. And HIIT training is high-intensity interval training. And what that shows is no, this is the one from underneath. I'm just going to make sure my power doesn't go out here and make sure I got a good power cord here. Try the 4 ones. Okay. So HIIT training blood draw prior is going to increase your outcomes, and it's going to increase the amount of platelets you produce. So a lot of our patients, they'll go into our gym, they'll do some treadmill, or if they have bad knees, they'll get on the bike and do some exercise biking to fatigue. Infrared heat afterwards, we put all of our patients kind of on into our infrared sauna afterwards. A lot of them get their own home programs and home infrared, but infrared heat helps with healing, detoxification, cell health. Love infrared heat. Medical fitness is super important. You either, add fitness to your facility, or, when we started, what we did is we hired a single personal trainer. We had him kind of co-op with Anytime Fitness and say, hey, Anytime Fitness, can we train out of your facility? He started doing fitness training out of the local Anytime Fitness or out of the local gyms. And eventually that's what enabled us to grow. We have 10 personal trainers, boot camp training, all kinds of stuff. But that's a good ancillary service, and we can teach you how to start very lean, adding fitness onto your program to be green very quickly. And eventually, if you want to grow into what we've done, that's something that's doable as well. So really, the medical fitness of the future is really personalized fitness, looking at what we call a bioscore. We look at what's happening genetically, what's happening with their antioxidant levels, what's happening with their hormones. You put all this together and you can really create an amazing way to create really good cell health. The better the cell health, the better their outcomes. So these last few things here are going to be pretty quick. We've got, maybe 5-10 minutes left before questions. And functional movement is, are they flexible? Are they strong? Do they have good fascial health? That deals a lot with physical therapy. Your osteopathic or your chiropractic colleagues, they're experts on this. So you develop good relationships with them, because they're going to be a referral source for you. But you can also scratch them back, because that functional movement, that functional health is so important. Functional movement, like I said, the goal of that is to improve their functional movement such that they have less degeneration, so that they have better movement patterns, to create those dysfunctional movement patterns that are leading to the degeneration in their body. There's a lot of different things we can do. We talked about treating the spine. When you treat the spine, it creates more functional movement, and in the end is going to restore their core strength. When you do prolotherapy, PRP stem cells to ligaments, it restores balance and symmetry. It restores stability. Stem cells, PRP to joints, helps with the restricted range of motion again. And less pain. When they have less pain, they're less inhibited as well. The final thing, which I think is super exciting, is what's happening with the nerves. I can't see a show of hands because we're online, but I'd be curious how many of you guys out there are treating the nerves. How many people are looking at peripheral nerves as a source of pain, but also even more as entrapped peripheral nerves as a source of dysfunction to the joint. And I'll touch base on that a little bit here too, so you know what that is. So there's a lot of things we can do with nerves, from topical creams. We can do different supplements that have been shown to be helpful for nerve degeneration, like turmeric, omega-3s. You can do physical therapy. You can do perineural injections. You can also do ultrasound-guided deeper injections. For example, carpal tunnel is a very common area where you do an ultrasound-guided carpal tunnel release to release the impinged median nerve to get dysfunction back in. Now, there's over 30 entrapment type syndromes in the body. So carpal tunnel is not the only one. There's a lot of other places we can release entrapped nerves. The other we kind of alluded to, epidurals, how they're not great unless you do a sweet caudal epidural, which is using a dextrose-based epidural, or you can do a sweet transforaminal epidural. Dextrose has no negative side effects, has been studied in the spine. It's very safe, but it does have a great outcome with pain. Why are we treating these nerves? It goes back to the 1800s. Sir Hilton was an anatomist, and he was doing all these dissections, and he found that every nerve that goes past a joint sends a little branch of that nerve into the joint, right? So the saphenous nerve, the genicular nerves around the knee, the axillary, the suprascapular around the shoulder. Of course, anything coming out of the spine is going to affect the lower extremity health. So we need to look at some of these nerve entrapments, stenosis in the spine, and do things to release the entrapped nerves, because once they're healthier, the things that we're treating with PRP and prolotherapy will have better outcomes when you get better function of the nerves themselves. And so I'm going to go into a slide here that shows the why on that question, which I think is super interesting. So this slide here just says basically with nerves, the reason we develop pathology is because nerves have to run through structures. So look at my arm here, right? Nerve comes out of my neck, takes an angle through my shoulder, takes an angle at the elbow, takes an angle at the knee, or at the wrist here. All those angles are going to be stresses to that median radial ulnar nerve. It also can get it pinched going through fascial planes. So a nerve can get entrenched in the fascial planes, which causes dysfunction. When there's dysfunction in these wires, it's going to cause dysfunction into the joints or the muscles they innervate. So we have to address those issues. Again, I talked about all those tunnel syndromes, and I teach how to treat these all the time. There's a lot of places where we need to learn how to hydrodissect nerves, free nerves up from impingement areas to get better function downstream from those nerves. Why do we do this? Is because what's happening is if there's tension, compression at a nerve for over not too long a time, a couple minutes, of greater than about 60 millimeters of mercury of pressure, that tension causes a little bit of hypoxia there, which releases two different neuroinflammatory peptides, substance P and CGRP. So what do? Substance P causes pain, swelling, achiness, apathy, those types of things. But CGRP, this is super interesting, causes neovascularization. We see that in ultrasound all the time. There's abnormal blood vessel formation. CGRP from a strangled entrapped nerve causes collagenylysis, tendon tears, tendon rupture, tendon breakdown. It causes calcification. We often see calcific tendonitis when we do these ultrasounds of the shoulder. It's because the CGRP from the impinged axillary or suprascapular nerve is causing calcification. It also causes osteoclast activity, which induces increased or decreased bone structure and stress fracture type activity. So inflamed nerves aren't good. Our goal with our nerve treatments is to release the site of compression and restore that nerve to normal function. So there's some new things coming out now with looking at dextrose, looking at mannitol, looking at platelet lysate or platelet releaseate, that these structures, when injected around a nerve, actually act as an antagonist to what's called the TRPV1 ion receptor, which is the ion receptor that's releasing the CGRP and the substance P. So we can actually have a physiologic block of the pathologic nerve as well as releasing the entrapped nerve as well. So a lot of different things, like I said, from dextrose to taking your platelets and cracking them open, which is a releaseate type technique that creates platelet lysate, which is a bunch of active growth factors that you can put in the spinal space and around peripheral nerves. So really want to think about treating these peripheral nerves when you're doing PRP and other stem cell procedures to really optimize the outcome and the healing potential in those areas. Some of the different things that you can do the perineural or the lift-off technique, which is just a subcutaneous injection around those nerves, or if you have access to an ultrasound, you can learn how to do ultrasound-guided hydrodissections, which is something I'm passionate about teaching because the outcomes are so great. Some examples of some perineural injections you can do for pain. And then you have the ultrasound-guided deeper nerves. Here's the ultrasound-guided carpal tunnel release. There you can see the nerve now is floating. That's the donut sign with this solution, which is an antagonist to the TRPV1 ion channel, releasing CGRP, not only releasing the nerve, those fascia kind of bands and adhesions in there, but also having a direct effect on the TRPV1 receptor ion channel. Dextrose is now safe in the carpal tunnel. A Mayo study showing it helps to release those areas. Dextrose is safe in the epidural space, a study done in 2016 and then repeated and re-looked at in 2018, showing that it's very safe in the epidural space and can cause some better and long-term outcomes compared to steroids. Here's the 2018 version of that study as well. Pretty exciting stuff. So to sum it all up, we really want to do things to optimize outcomes. And to do that, that's where the CFAN model can be very helpful. The C of the CFAN model is anything from cell health to nutrition to exercise to movement to eventually higher end things like genetic testing and peptides and hormones. We need to treat the functional movement, get them exercising, get them good posture, look at their fascia, look what's happening there. We need to look at that articulation to get that joint healthy. And finally, we have to look at the nerve health, because if nerves are impinged or dysfunctional, it's going to cause localized breakdown of the tissue and as well to things that they are innervating. So the cool thing about this is when we start to be innovative, when we start to learn more about technology, when we start to learn more about PRP and stem cells and things they can do, which are all research and evidence-based, we can start to integrate that into our practices, and in integrating the other things, the lifestyle, the functional movement, the articulation, the nerve procedures, eventually what that's going to lead in your practice is really an optimization of your practice outcomes, which means you're going to have a zillion walking billboards, people talking about how amazing your outcomes are, which is the best marketing and business strategy you can do, is to have great outcomes in your patients, really. So really, what we're finding here too is us as physicians is we can be amazing at what we do, but where we're broken and where we struggle is our ability to present ourselves. And what I put together is another thing. What I'm passionate about is teaching doctors to be amazing, and that kind of gets to what I call the 5 pillars of success. And that's where I have Rejuve Medical as my practice. Rejuve MedFit is how I teach doctors to be amazing, from everything from injection technique to how do you do business, sales and marketing. How do you integrate medical fitness, which is lifestyle practices, into your practice? And how do you put it all together? How do you take this and make it work and make this part of your brand? So very awesome things that we're doing there. My why are my 3 kids. I mean, everything I do is to go home and hang out with these guys and to laugh and have fun. And so these are my three kids, and the reason I am excited about everything I do. I did want to invite you guys to join us actually coming up here really soon, September 20th to 22nd. We're going to have our 5th annual summit. What we call it is our Integrative Practice Success Summit. Our goal is to teach people those 5 pillars. How do you become the best version of yourself? I do a talk called Becoming Superman, and it's being very vulnerable, being very real about who you are, and becoming the best version of yourself. We do a lot of really practical business. How do you run a business? How do you hire, fire? How do you create core values? A lot of marketing. How do you market who you are such that you can present yourself to your community, to your state, and start driving those leads to your practice? The next pillar is the sales. Once you got all these leads, how do you convert them into a patient that wants to come see you for the procedures that you're performing? A big part of the summit too is actually regenerative procedures. We go into how do you do these nerve treatments? How do you do PRP? How do you do stem cells? The topic of this next one, it's going to coincide with the release of my new injection manual, is going to be the lower extremity. So looking at the hips, the knees, the ankles, and what we can do using ultrasound guidance to optimize those outcomes. So super healthy, super excited about that coming up. I'd love to meet all of you guys there as well. It's coming up this September. Just go to info@healthelevaders.com. You can also email Garrett, Garrett, @rejuvemedical.com. So super excited about everything that's going on. Super excited to be a part of Apex and their training and spreading the word on what we can do, which are going to be very amazing, and getting our patient outcomes to be better. So I want to open this up now. I think we've got a few minutes for questions.
Great. Yeah. Thank you, Dr. Baumgartner. Great information. Very exciting what you guys are doing over at Rejuve. We do have some time now for a few questions. So I'll go ahead and start. This question is, when doing a PRP treatment, are you always making use of the platelet-poor plasma? If so, how?
So I'd say it depends on the area. So for example, anytime I'm doing a shoulder, low back, cervical spine, anything spinal, or usually large joints, I do use a lot of platelet-poor plasma because you tend to run out of the PRP. So the question I get is, well, how do I know what to do and where do I put it? Well, put your PRP and your stem cells to the area of the most degeneration. So if I'm doing a shoulder and they have a large rotator cuff tear, I'm putting my stem cells there. At the same time I'm doing the stem cell, I'm making some PRP. I'm putting that into possibly the joint if they have mild to moderate arthritis, or I might flip that. I might put my stem cells into the joint and my PRP into the rotator cuff tears. Then once I run out of that solution, then I have the rest of my platelet-poor plasma created for me on the side. I have my assistants make that platelet-poor plasma at about a 20% dextrose solution. So you just add dextrose to it, just like you would create prolotherapy. And then that platelet-poor plasma is great for fascia. Platelet-poor plasma is great for muscles. So I put that into all the rest of the structures that I have to treat. So like I said, these injections are very comprehensive. If any of you guys do my training or get the new book, you're going to see, oh my gosh, I need 50 cc's of solution to make this work. Well, just use the rest of your platelet-poor plasma with Prolo, and that's going to help increase those success rates.
Great. Next question. How much bone marrow aspirate can a patient tolerate, or how do you determine how much to draw from a patient?
So the max that I'll do on my patients is around 60 to 70 cc's of bone marrow aspirate. Once you get over that, you're getting a little bit over what's kind of been researched in healthy or safe. Some places say up to 100 cc's, but I usually tend to be around 60 to 70. If I'm doing a thumb, you don't need that much. Usually I will draw the max. I want to try to get as many stem cells as possible because, when you spin it down, you don't have a lot of stem cells left to work with as far as your volume. Again, back to some of those things we talked about with those stem cell draws. Get your patients practicing super healthy nutrition up to a month beforehand. Get them intermittent fasting, which can be as simple as don't eat till noon every day. It's going to increase your stem cell numbers and the viability in those stem cells as well, but up to about 60, up to 100.
Okay, great. Kind of a follow-up question to that. So if a patient comes in and they aren't in the best shape and they're looking to do a stem cell injection, how do you approach, or I guess, how do you introduce your health program to them?
Yeah, it's on every single patient I have this conversation with them. I'm very nice about calling them overweight, but I like to say, hey, you're going to be investing in me. We're going to be investing in the stem cells. It's not cheap for you. And I assume you want the optimal outcomes with the procedures we're going to be doing. An issue I probably will have with you is the fact that you are 50 pounds, above the ideal body weight that I'd like to have you at. Now, would you like me to help you with that? Oh, yes, please help me. Okay, well, we have a couple of different options. In fact, then I'll give them my card. This card is basically an online card that has regenerative.com with a username and password on there. They will take that and they'll log in and they will get my 6 elements of health, which talks about nutrition, weight loss, exercise, cell health, all those things we talked about, which is just kind of a basic platform. And it'll give them kind of a nutrition plan to kind of go off if they just want the online digital version. Of course, I'll say, but by the way, I do have personal trainers. If you want to meet with my personal trainer or my health coach, they will guide you on how to do this. They will hold you accountable. They're going to help you make lifestyle changes. So a lot of things when I'm counseling physicians on, oh, gosh, this sounds amazing. I want these outcomes. And I say, well, go to your local gym, observe which personal trainer you feel is amazing. Hire him as your first hire on your medical fitness side. If you have one good trainer, they can be your health coach. They can, start to implement different healthy lifestyle changes into your practice, and they can charge cash for that. So you have this, even if you have a small little room where they're doing the counseling in the room, you can eventually have that trainer get outside, get to a warehouse, or like I said, what I did is I had them go to the local Anytime Fitness. So you can either do it in-house. Another thing you can do too is if you want to, go create a relationship with your local gym, your Anytime Fitness. Say, hey, I'd like to give a free talk to all of your personal trainers. They have 10 personal trainers. Hey, I'm the new doctor in town. I've got these amazing things. I'd like to partner with you guys. I'd like to provide, if you have any personal training clients that are injured or breaking down or complaining of pain, please send them to me. I'd love to send to you a lot of weight loss clients and patients that I need to be healthy. So if you don't want to do it in-house and create a revenue stream for yourself, develop relationships with those outside there that have the same passion as you do, which is creating health, weight loss in those clients as well.
Awesome. You covered quite a bit there, so I just want to touch on a couple points. Sure. On that Health University, is that something that you offer for free? And this is not signing up with your health and fitness coach, but you mentioned going online and they would see health plans. Is that something you're offering for free to the patient before their stem cell injection?
Totally free. And the reason for that is, we talked about market competition, right? So if someone's, I might want to see Dr. Baumgartner, or this guy down the road kind of does the same thing. Dr. Baumgartner is giving me all this free online stuff, information. He's going to change my lifestyle. He's doing all this stuff, and it's no extra cost for me. It's a no-brainer. So it's a great marketing tool. It shows that you care. It shows that you're trying to do more for their overall health. It's no extra cost for them, but it's going to increase your outcomes. Again, the better outcomes you have because you got them to lose 10 pounds before your procedure. They're going to talk more about you in your community, which creates that walking billboard for you. So that is absolutely free. Now, of course, all of us are business people as well. So that online platform, they can click upgrade. When they click upgrade, they'll take them to an online personal trainer. And one of my personal trainers then will digitally be their coach every week and for an updated cost, right? So you always want to have upgrades. And even if you're doing PRP, you can either do my PRP or you can upgrade to a stem cell procedure. You can do my PRP or you can upgrade to the Platinum, which is stem cells with PRP and your personal health coach. So the information is free, but there's always the upgrade. Does that make sense from a business perspective?
Yeah, totally. That makes total sense. Awesome. So this is also another business question, and you've covered quite a bit of this as far as finding partners and local gyms to work at. But when building an integrative practice where you include the health, the fitness, the cell therapy, You mentioned growing lean. Anything that you've mentioned that you, or I guess any other tips or tricks you want to mention other than what you've already kind of discussed?
Yeah, for sure. So, like I said, we've been doing this for 15 years and we have figured out how to do everything the wrong way. So, that's what makes us really good at teaching people how to do this the right way. I think some of the big mistakes we've made is we try to go too big too soon. And so, when we are teaching a lot of our other physician colleagues and a lot of people that join us in our MedFit stuff, is we teach them how to be very green and to go slow. So, as opposed to, man, I want to do all this, I'm going to build onto my practice, I'm going to build on a gym, and I'm going to do infrared, and I'm going to do all that stuff. I say, no. Why don't you, like I said before, go to the local gym, observe who's the best, ask that person if he'd like a much cooler job than he currently has. Say, okay, if you come in, and my first personal trainer offered the guy about $50,000 a year to come in, do personal training, do health coaching, do weight loss. So for $50,000 I paid him, he probably generated $500,000 worth of money for my practice. The reason it happened, that was within 6 months, is because we kept it super lean. I used one of my exam rooms that I converted, put a treadmill in there. You saw the picture of it, treadmill and some exercise equipment. In the summertime, we did online outdoor boot camps. Eventually, that department was making so much money, we started renting a warehouse and we started lean. So again, adding fitness to your practice does a lot of great things for you. But if you go too big, it can actually break you and make a bigger hole for you. So there's very smart, lean ways to do it. And the best way to do that is to find an amazing, passionate person, ideally a personal trainer or someone with an exercise physiology background that's going to come and join you and be the face of your fitness and lifestyle program.
That's awesome. Well, thank you, Dr. Baumgartner. You shared lots of useful tips and tricks. This whole holistic approach that you guys are doing at Rejuve is amazing, and no wonder why your patients are, raving about your treatments there. We want to thank everyone for joining us this afternoon. This webinar is recorded and will be sent out. We'll also be sending out some information from the Rejuve MedFit program, if that is something you're looking to be a part of. Thanks, Dr. Baumgartner.
You're welcome. My pleasure. Anytime.
Have a good one.
All right, see you next time.